Hi everyone, Tim here from Active Podiatry. I hope you're all well. Now today in clinic was a little bit of a different sort of day for me, in that I did a fungal nail treatment on a patient. Now, although a lot of what I do is dealing with sports injuries, I'm a sports podiatrist, running injuries, that sort of thing, I do also do the full scope of podiatry. And that also includes doing what might be sometimes termed as general foot care problems, such as removing corns, calluses, verrucas, ingrown toenails, that kind of thing. One of the things I find really satisfying to treat in the field of general foot care is fungal nail infections. And the reason it's so satisfying, it used to be quite frustrating, quite a difficult thing to deal with, because the fungal infection gets underneath the nails. That's exactly the problem. It's underneath the nail and it's very hard to get to it. With any treatment, you put a lacquer or an antifungal and it just sits on top of the nail, doesn't get through to the nail bed. You can take oral antifungals, but some people are concerned about the listed side effects that can be quite unpleasant. So people come to me looking for alternatives to taking a tablet. And what I use here in clinic is sometimes called the Lacuna or fenustration method. And what that involves is using a precision medical drill we all have in our podiatry clinics to make tiny little holes in the nail plate in order that antifungals can get through to the nail bed underneath. Now remember I said that one of the problems with the fungal infection is underneath the nail, and it's very hard to get to it because the nail gets in the way, perversely sort of protects it from the cure. Now with this technique, what we can do is we can make tiny little holes in the nail, and that allows the antifungal to go through to the nail bed. We have very good, very strong antifungals on the market now that can extremely effective against fungal infection. The particular medication we use is a drug called terbinafine, which is also the one you take orally, but in this context we're using it topically on the skin through the nail. It has almost zero side effects, so it's very good, and it's pretty much okay for anybody to use, assuming there are no sort of allergies to that particular product. So just have a quick look at the equipment. So what we've got here is the precision drill, and that runs at certain speeds, 15,000 RPM, just to get through the nail, which is hard. And then we have these tiny little drill burrs, and as you can see, they're tiny little things that we use to get through the nail. Now, one of the concerns people say to me is, I don't like the idea of having my nails drilled through. That sounds really painful. And I guess it does, but if you think about it, the nail is dead tissue. There's no nerve endings in the nail itself. If you cut your nails, it doesn't usually hurt to cut your nails with a big pair of clippers or a pair of sharp scissors. So in the same way, just making these little holes, we're just going into the nail plate, not the nail bed, and it's usually completely pain-free, so there's nothing to be concerned about. Sometimes what you do sometimes get is a little bit of a pricking sensation, which is people describe to me as like having a tiny hair pulled, and that's because in places where the nail plate is thin and it's attached to the nail bed, you get a bit of vibration as the drill goes through, and that can cause a little bit of a pulling sensation, but it's no more unpleasant than that. And the majority of patients I see are really happy with it. It does get really good results. It's not a cure for every single kind of, in terms of improving the appearance. The results can be variable. If you've got a really sort of thickened, crumbly nail that's been like that for years, and it's fully infected all the way through, then you're probably not going to get a perfect sort of supermodel looking nails just with this treatment, because there's going to be damage to the nail bed. But you can pretty much guarantee that it's going to get rid of the fungal infection. And we have a whole course of treatment around that to make sure that the fungal infection is cleared from the skin, and we're reducing the risk of it reoccurring with the treatment plan. So again, it's just something that I find really effective, really satisfying. I've had some some really good results, some very happy patients. You know, it's something I take a lot of pleasure in doing, just being able to help people with these kind of manky looking toenails, if I can use a technical medical term there. So if this is something that you're interested, do give us a call, get in touch, and I'll be happy to kind of talk you through it, and and we can plan that in. So. But prevention is better than cure. Finally, so the way to prevent fungal infection is to look after your skin. The best barrier to infection is intact, healthy skin. So make sure if your skin is dry that you're moisturising it. That you're sort of looking after your foot hygiene. You're drying carefully between your toes so that athlete's foot doesn't get a chance to form between the toes. Athlete's foot is a precursor to fungal nail infection. It's the same infection. It's just if it's on the skin, we call it athlete's foot, and if it jumps onto the nails, we call it a fungal nail infection. So if you look after your skin, if you look after your foot hygiene, deal with any athlete's foot you see, deal with it straight away, treat it, don't leave it to fester. Then you're going to reduce your risk of getting an infection in the first place. The other thing is also to look after your nails, make sure you're not cutting them too short and not letting them get too long. And that will reduce the risk of repetitive trauma to the nails, which can cause the nail to lift and allow the fungus to get in underneath. So there you go. That's that in a nutshell. That's fungal nail infection. That's Lacuna. Fenustration is the treatment we use to get rid of it. It's really straightforward, pain-free, very effective, and very satisfying for the patient. So check it out if that's something that you're interested in. As always, if you have any questions or comments, pop them in the comments below. You can contact me on social media in the usual way. And in the meantime, take care, and I will speak to you soon. Bye for now.